Good afternoon, everyone, and welcome to our Perform Colloquium on the Road to Positive Mental Health. My name is Wendy Cunin. I will be acting as host for today's talk. I'm the Research Operations Advisor at the Perform Center. For those of you who are not familiar with Perform, it is a preventative and health research center. In addition to the multidisciplinary research that takes place at Perform, it is also host to many community programs. We offer a variety of programs from people wanting to maintain a healthy lifestyle to those with disabilities or chronic illness who need assistance with training. As part of Concordia University, Perform also has various education programs such as our clinical exercise physiology, athletic therapy, and dietetic internship programs, whereby students work with our certified professionals and gain real-life experience. Generally, the Perform Colloquium is an academic talk whereby local and international researchers are invited to present their research. However, in these uncertain times, we decided to turn our talks to the community who we believe can benefit from it the most. Our speaker today is Dr. Shawn Wilkinson. Shawn is an assistant professor in the Department of Applied Human Sciences at Concordia University. He teaches both leisure and therapeutic recreation courses offered by the department. He plays a pivotal role in helping to prepare pre-service leisure professionals for their careers in therapeutic recreation and community leisure. His current research focuses on the development of leisure education programs for persons living in the community. He is currently working on several research projects that provide leisure education services to elementary-age school children, older adults, and persons living in the community with serious mental health problems. Before I pass over the mic, I would just like to request that our audience use the Q&A button to enter any questions that you may have for our speaker. We'll do our best to answer all questions following the talk. Please also note that this talk is being recorded and will be posted on the Perform website for later viewing, along with any questions that we're unable to answer at the end. Thank you very much, and over to you, Shawn.
Thank you, Wendy, for that wonderful introduction. As Wendy mentioned, I am Shawn Wilkinson. I am an assistant professor in the Department of Applied Human Sciences, and I teach in the leisure and therapeutic recreation streams in that department. And my research focuses on leisure education and leisure engagement as a form of active intervention for persons living with and without mental health problems in the community. So it's an area that interests me very much. I'd like to start today by thanking all of you for joining in. I know that many of us have spent the better part of the last 3 months in front of a screen in our homes or in our offices, so I thank you for your time today. And a special thank you as well to Wendy and other members of the Science Committee at Perform for inviting me to give this talk. Now, I've had the pleasure of already co-teaching a course online in the last few weeks to months with two wonderful colleagues, Dr. Stephen Henley and Professor Robert Hopp, who are on the call today. But this is my first time giving a presentation on Zoom, so bear with me. I promise you I'm a lot more engaging and fun in person, but I'll see what I can do. So over the next 30 to 40 minutes, I'd like to talk about on the road to positive mental health. And the way that I'm going to do that is to talk a little bit about positioning. So to tell you about some of the education and academic and life experiences that I've had, which have shaped my views of mental health and mental health problems, and how that shaped my presentation today. Present to you some of the more robust facts and figures about mental health problems and ones that we often see, and discuss those a little bit. Then I want to dig into and talk about what do we mean by the term mental health, because a lot of our discussions around mental health focus on a disability-based, problem-oriented approach. So I want to focus on the positive aspects of mental health. But I think it's also equally important to talk about mental health problems. So we'll break those down and talk a little bit about the etiology or the cause, the symptomatology or the different types of symptoms that we experience, how one with a mental health problem is diagnosed, and how treatment occurs. And then off the back of treatment, we're going to talk a little bit about maintaining positive mental health or improving our mental health. If we do have a mental health problem, what are some of the things that we can do? And then I want to focus specifically on leisure and mental health. And that's my area of interest, and one that is close to my heart, and one that I feel is often or maybe neglected as a form of treating mental health problems and maintaining positive mental health. So there are different education and training experiences which have shaped my views of mental health. So many, many years ago, I had the pleasure of doing a BA at Concordia University, where I teach now in the Department of Applied Human Sciences and Therapeutic Recreation. And that's where I really fell in love with studying mental health and mental health problems. And I had an opportunity there to see leisure being used as a form of intervention to treat a number of different health conditions, including persons with mental health problems. I then went on to do an MA and PhD at McGill University in the Department of Kinesiology and Physical Education. But although I was housed in that department, our lab was at the Douglas Mental Health University Institute. So I spent a significant amount of time at Douglas learning about institutionalization, learning about our mental health system, learning about the history and traditions around mental health and mental health treatment, as well as some of the more novel and newer treatments that are in place today to treat persons with mental health problems. And through all of those degrees, the field experiences and the research that I've done has allowed me to really learn from and make connections with and work with people with a range of mental health problems. So I've worked with children with ADHD as young as 6 and 7 years old. I've worked with adolescents experiencing their first episode of psychosis. I've worked with adults between the ages of 25 and 55 who have schizophrenia spectrum disorders. And I've also had the pleasure of working with older adults living with various forms of dementia. Now, it isn't only my education and academic experience which have shaped me, my life experiences have shaped me as well. So I'm not only a researcher of mental health and someone who provides different forms of intervention, I've also had my own mental health issues around anxiety since I was young. The first time that my parents took me to see a psychologist, it was about the age of 6. And funny enough, oddly enough, I had a fear of going to school. I couldn't go to school and I couldn't do so for quite some time. And I say that's funny because years later, when I started my master's degree, my mother said to me, God rest her soul, she said to me, you know, Shawn, I find it odd that you had all this anxiety around school and you still want to go to school. So you must be some type of glutton for punishment. And with that, I certainly agree. I was raised in a 2-parent family, but predominantly raised with my mom. My dad was a factory worker, so for the better part of my childhood and adolescence, my dad worked 7 days a week, many hours a day, to help pay for private schooling and other things that we needed. I lived and was raised predominantly by my mom, who was living with a trauma-related disorder from early childhood trauma experiences. So there were, of course, a number of different issues around depression, anxiety, and the use of anxiolytics, antipsychotics, and antidepressants to treat those. So discussions around mental health problems, psychiatry, psychology, prescriptions, etc., were quite common in my childhood and adolescence. And in the last 5 years, before both of my parents have passed away, my mother recently in January and my father a couple of years ago, both were diagnosed with different forms of dementia. My mom with Lewy body, my father with Alzheimer's. So I've had the pleasure of caring for both of them. And the education and academic experiences that I gained served me extremely well there. But this was the first time I was acting as a caretaker for a family member with a major mental health problem. So that's really shaped my experience as well. So I come from a position today, not only as a researcher, as an academic, but as someone who's experienced mental health, who's lived with family members with mental health, and who's cared for family members with mental health problems. But I'm certainly not the only one, as we can see by the statistics I'm going to present to you here. Mental health is, of course, a prevalent problem in our society. It's something that we've paid greater attention to in the last few decades, and we need to continue to pay attention to moving forward. And the stat we often hear is the famous 1 in 5. And we know this stat more and more because of Bell Let's Talk Day and other mental health initiatives, which suggest that about 1 in 5 Canadians experience a mental health problem. And when I present this stat to my students, I often say the 1 in 5 is discussed, and sometimes we talk about 1 in 4 in the US and 1 in 6 across the globe. So there's some room for error there, like with any statistic. But I talk about the 5 in 5 stat, and the 5 in 5 stat is something that I talk to my students about because you may not be the person experiencing a mental health problem, but most of us work with, live with, are in a family with, or care for someone with a mental health problem. So it affects us as Canadians and as individuals throughout the population. It affects all of us. What we see across the globe and in Canada is that there is very high levels of depression and anxiety-related disorders. So about 264 to 300 million people globally identify with depression, and 284 to 300 million live with anxiety-related disorders. So these are affective disorders. And similarly in Canada, 11.6% of Canadians over the age of 18 reported a mood or anxiety disorder. Now, a stat here that I'm going to talk about, and one that really resonates with me, is that 70% of mental health problems initially onset in childhood or adolescence. So this means that for most people, mental health problems occur across the lifespan. So it has a significant effect on shaping who they are as individuals, as well as shaping their interactions with their communities. As well, 24% of all deaths among 15 to 24-year-olds and 16% among 25 to 44-year-olds is caused by suicide. And we know the relationship between suicide and serious mental health problems. And this amount of death is second only to accidents for that age group. So it is a major issue. So the important piece here is to recognize that a number of people are affected by mental health problems. It is a serious issue. It does affect people early on in life, and it can lead to suicide and death in a significant number of younger people. But what do we mean when we're talking about mental health? So I'm presenting a definition here from the WHO, which suggests that mental health is a state of well-being in which an individual realizes his or her own abilities, they can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. And I just want to take a moment here to break that down. What do we mean by a state? Well, a state is something that, of course, changes. So we can have positive mental health, we can have a mental health problem, and we can work towards improving our mental health. We are able to realize our own abilities. So we understand what we are capable of doing, where we need help, and we follow through with those things we're able to do. We can cope with the normal stresses of life. And the normal stresses of life are things that we may face on a day-to-day basis: childcare, paying the bills, dealing with our neighbor, going to work, being productive. Now, being productive and making a contribution to the community, I don't like to limit this idea to simply work production. I think about other people in the community who make contributions in different ways, through caring for their elders, through educating the youth, through caring for themselves, and making other contributions in community through volunteering and education. So we know that one's mental health is a personal resource that develops over the course of one's life. So we certainly engage with and interact with other people throughout the course of our life. Some of those are positive, some of those interactions are negative, and some of those lead us to deal with mental health and mental health problems. So we're able to develop that resource over life, that resiliency, and get through those situations in life. Now, if we're affected by a mental health problem early on in life, of course, that's going to impact the development of this resiliency and this resource. It also includes a sense of coherence to function well, despite the challenges we face. We're all facing challenges, and some of those challenges, particularly in the last several months, have been unique. But if we're able to find a way to function through them, it adds to our positive mental health. It also includes the resiliency to bounce back from various setbacks, like the loss of a job, the loss of a loved one. Of course, this isn't to minimize that loss, and it isn't to say that there isn't a grieving period associated with that, but there is a point where we need to be able to move on and go back to making those contributions to ourselves and community. It also involves the capacity to feel, think, and act in ways that are strengthen our ability to enjoy life. So what can we do for ourselves that can make our life better on a daily basis? And for me, one of those things is leisure, and something that we're going to talk about in a bit more detail later on. And of course, it is intrinsic to the health and fundamental to our own well-being. So we cannot be healthy without positive mental health. And of course, there's an interaction between mental and physical health that most of us are aware of. That we know that when we are living with mental health problems, it can affect our physical body. And when we have physical health problems, it can, of course, affect our mental health. Traditionally, we have conceptualized mental health according to the absence of symptoms of psychopathology. So what that means is a lot of the work done early on in mental health focused specifically on the problems. So you either had a mental health problem or you didn't. And if you were absent of that mental health problem, it meant you were in good mental health. We've changed that view over time towards a more complete state view, where we view individuals as not only free of those symptoms, but flourishing with high levels of emotional, psychological, and social well-being. So they're engaging in those things in their community, which help them to tap into their different emotional, psychological, and social well-being. Now, I take it one step further and suggest that even if someone has a mental health problem, it doesn't mean that they can't have positive mental health moments and that they can't work towards improving their mental health. We know that mental health is more than just the absence of a diagnosed mental health problem. And of course, there's been this greater focus on well-being and functioning rather than the dysfunctions and disorders. However, that isn't to say that we shouldn't continue to study mental health problems and we shouldn't continue to focus on educating people about mental health problems to help people to be more aware of potentially their own problems and to help fight stigma in the community. So when we talk about a person having a mental health problem, we're talking about them having alterations in their thinking, mood, or behavior, or a combination of those, which is associated with significant distress and impaired functioning. So what does that mean? So it means that, let's say, for example, you go to work and you think through your processes at work, or you care for a family member, or you're in childcare and you think through those processes every day, but your thinking becomes altered when you're dealing with a mental health problem. So we often talk about not thinking clearly, not being able to have the use of executive functioning, trouble with planning, trouble with remembering. There are also changes to our moods, elevations in moods, where we feel these highs, we can't sleep, our thoughts are racing, we're unable to relax. Or those down trends in mood, where we have very limited to no energy, we don't feel like getting out of bed or engaging and interacting with other people. And changes in the behavior or the way that we act. So acting erratically, doing things out of character, spending significant amounts of money, leaving for long periods of time, doing things that we have not done in the past. And those are associated with distress and impaired functioning. So what we mean there is that what we're used to doing, the way we're used to functioning, so I get up every morning, I have my coffee, I have a shower, I get dressed, I go to work, I come home, I pick my children up from school, etc. I'm unable to do those things. Something has changed which has affected that level of functioning. So what causes a mental health problem? Well, mental health problems are most likely attributed to a complex interaction of all biological, psychosocial, and environmental factors. So there isn't really one thing that causes a mental health problem. And we were able to study that interaction of issues through the biopsychosocial model, which provides us with a framework for understanding the different factors that contribute to our mental health problems. So this model proposes that biological, social, and psychological factors are involved in the causes, manifestation, course, and outcome of health and disease. And that is a visual representation of that here. So just take a moment to take this Venn diagram in and take a look at how the various issues can impact an individual's mental health. So we'll just take a moment to break some of those down. So some biological factors involved in the development of mental health problem include genetics. Research does suggest that there are genetic predispositions to a mental health problem. So a good example of that is about 1% of people report experiencing schizophrenia. However, in families where a first-person relative, like a parent or brother or sister, has schizophrenia, it's about a 10% chance. If we look at both parents having schizophrenia, it's about a 40 to 45% chance of the offspring having schizophrenia. And in identical twins, it's about a 50 to 55% chance. So we do see that genetics do play a factor. There are also those psychological factors which are involved in the development of mental health problems. So those negative life events which come about, one we hear more and more about on a daily basis are combat-related stress and the effects on soldiers and workers in those environments and post-traumatic stress disorder. Of course, a lot of us in the last few months have went through very stressful situations with changes to our routine, changes to our environments, and add on top of that what we're seeing in the media on a daily basis with regards to deaths, race-related issues, rioting, and trouble in the United States and across the globe. Of course, that's going to impact the day-to-day stress that we feel if we're someone who follows those events, and the people living in those events are going to be affected by those that related stress and the post-traumatic stress that may come along with it. There are also a number of social factors involved in the development of mental health problem, and this includes, for example, family circumstances, so things like poverty and drug use. If we look at some of the statistics on poverty, drug use, family abuse, and the rates of mental health problems, we can see that family circumstances can certainly play a role in the development of mental health problems. So how do we know that we are experiencing a mental health problems? Well, we often present with signs and symptoms. So what we mean by a symptom is something that is defined as an obvious change in our normal health that happens when an illness or disease occurs. Symptoms related to mental health problem include those changes that we talked about in thinking, mood, behavior, or some combination of all three. Symptoms of a mental health problem occur along a continuum, and their severity will range from mild to severe. So this means that not everyone experiences the same diagnosis in the same way. Severity can impact the way that we function. So for some people, they're able to take a somatic or psychotherapeutic treatment, and then they're able to function quite well. And for other individuals, their mental health problem requires some form of institutionalization for a short or lengthy period of time because of the significant effect that it has on functioning. And the onset, duration, frequency, and types of symptoms, so how they come about, how long they last, how many times we see them, and the kind of symptoms that we experience vary across specific disorders and individuals. And there's two really major groups of symptoms, positive and negative. Positive doesn't in any way mean good. Positive symptoms are symptoms that add something to an individual's life, like hallucination or delusion, and those symptoms are seen mostly in schizophrenia spectrum disorders. And we have negative symptoms. Those are symptoms which take something away from somebody's life, and we see those symptoms in affective disorders and in schizophrenia spectrum as well. So how are we able to identify that we have a problem? Well, identifying a mental health problem can be often quite challenging. Think about it from a physical health problem perspective. Let's say you're aging, you're waking up quite frequently in the middle of the night, you're urinating quite a bit, you're having a lot of sweating, profuse sweating, you're having the shakes before and after meals, you're having some symptoms or some signs that are associated with diabetes. So you go to see your family physician calls for blood work, you have your blood work done, your blood work comes back, there's a suggestion that you have diabetes, you're put on a course of treatment. That isn't necessarily the case for mental health problems, because we're looking for patterns of symptoms and the effect that they have over a longer period of time. So it takes an additional period of time to follow a person to better understand whether or not the initial diagnosis you make is a correct one. So initially what happens is we do have these signs or symptoms, and either we feel the need to go in and see a doctor, or a family member feels the need for us to go in and see a doctor. And it's important to note here that that isn't always the case. We've come a long way in North America in discussing the stigma around mental health and being open about mental health, but that isn't the case for all cultures, even some cultures living in North America. Mental health problems can still be related to religion, punishment from God. There are some cultures which believe that mental health problems don't exist. We used to hear the term lazy, crazy, and stupid. So for many people, they will hide what they're experiencing, or their family members will not help them to come forward with those experiences. And that unfortunately leads them to have a delay in when they're going to be able to seek treatment. But when they do go forward and seek treatment, what we see are various screening tools that are used, a popular one being the Beck Depression Inventory. And these screening tools are used to take down some information and to gather an initial understanding of what is happening. So anyone who shows a potential sign of a mental health problem certainly should follow up with treatment. They should have an opportunity to see a specialist and to follow through with that particular type of treatment. Eventually, we want a diagnosis to be made. And a diagnosis is a specific medical term given by a healthcare practitioner to identify an illness. Initially, what happens, as I said, there may be a gap between identifying something wrong and seeking treatment. And then once we seek treatment and we look for a diagnosis, it's complex. So we can often start with a differential diagnosis. So we say, this might be all of the possible situations, or this might be all of the possible diagnoses that you may have. And then the medical team, clinicians can work with you through those diagnoses. We then can develop a specific diagnosis. So yes, in some cases, it's a little more clear cut. And in other cases, it takes a little bit longer. So initial diagnosis, which leads into a working diagnosis where we can start to treat the problem to see how effective treatment is. And then that diagnosis may change depending on the effectiveness of said treatment. So one example here I can give you is from working with people with schizophrenia spectrum disorders. There's schizophrenia and schizoaffective disorder. The two are very similar, but what we see in schizophrenia is a greater incident of positive symptoms, and in the schizoaffective disorder, we see a greater incident of affective symptoms. So many of the people that I worked with had been diagnosed with one or the other over time, and that diagnosis had changed. Now, why we diagnose and how we diagnose is we use these very well-known classification systems. So if you've ever been diagnosed with a mental health problem, or been with a family member who's been diagnosed with a mental health problem, that diagnosis occurred from one of these two manuals. And these manuals help us to classify and categorize the different symptoms that people experience and how those symptoms adding up over time lead to an official diagnosis. And then treatment can occur. So treatment approaches to any mental health problem can be categorized as somatic, relating to the body, or psychotherapeutic, relating to the mind. So that means, for example, things like drug treatments and brain stimulation treatments, those are somatic, and psychotherapy are these larger umbrella terms where we talk about identifying treatments which involve talking to a psychologist or a psychiatrist about those issues. Now, it's important here to note two things before I move on. One is that if you've been diagnosed with a mental health problem, or if you are in the process of being diagnosed, it is important to follow up with those particular treatments, to adhere to those treatments. What the research clearly suggests is that if we identify a problem early, we get treatment for that problem quickly, the course of an outcome of that problem is going to be much more positive. So although anyone here listening today with a diagnosed mental health problem or caring for someone with a mental health problem, what we're going to be talking about maintaining and improving mental health, you can certainly do all of these things, but it is also important to follow the course of treatment that your physician or psychologist/psychiatrist has set up for you. So how do we maintain or improve our mental health, or maintain positive mental health? Well, we can do a number of different things. And this is by no means a complete list, but 3 things that I wanted to cover today. Now, something that's omitted from this list, and that's very important, but it was talked about during the last colloquium, is sleep. Sleep is also an important component. We know that mental health problems can lead to disturbances in sleep, and we also know that disturbances in sleep can affect one's mental health. So sleep is an important component, but one I didn't mention here today because it was discussed at the last colloquium. But I do want to talk briefly about physical activity and exercise, as well as healthy eating. And that's only briefly because I want to spend a little bit more time on leisure engagement. And that's the area that I think for me is very interesting. So what about physical activity and exercise? Well, we know for years exercise was overlooked as an important intervention to treat mental health problems or maintain positive mental health. However, more recent studies have shown that exercise has been shown to improve mental health and lessen symptoms of depression, anxiety, and stress. Now, a lot of the early work was simply on cardio-related exercise, but there is also a number of different studies out there which look at the impact of things like stress relief, Tai Chi, meditation, and yoga, and the impact that those things can, of course, have on one's positive mental health. And we know from various studies that exercise can improve self-esteem and cognitive functioning, like positive mental health. Healthy eating can also be an important component to positive mental health. Nutritional psychiatry is a relatively new field, but one with very promising results. So we know that nutrition can be an important factor in maintaining positive mental health. Recent studies have suggested that a healthy diet consisting of higher intakes of fruit, vegetables, whole grains, and fish may reduce depression risk. And the consumption of adequate amounts of, and this is a very recent study I just pulled in January from Japan, which suggested that the consumption of adequate amounts of certain nutrients and food may lead to better mental health in Japanese adults. And I'm happy to share that link with you and post a study if people want to take a look at that. So again, healthy eating can be have a positive impact on our health and well-being, and of course the maintenance of our overall positive mental health, or improving our positive mental health. So not far from what we've been saying for quite a while, right? Which is try to live a healthy life, engage in some healthy eating, get good sleep, exercise routinely, and that's going to contribute to a positive overall health and well-being. Easier said than done, self-included. So what I want to talk a little bit more in detail today is about leisure engagement and why I believe that's an important component to positive mental health. So yes, you can go to work and do well at your job. Yes, you can eat well. Yes, you can sleep well. Yes, you can exercise. But what else are you doing for yourself as an individual? What are you engaging in that makes your life feel more enriched and meaningful? And that's really what leisure is. And that's what we train our pre-service professionals to go out in the world and do, is to teach others about the importance and value of leisure and to use it as an intervention strategy for healthy and less healthy populations. So what do I mean by leisure? Well, leisure is defined as a relatively freely chosen activity and its accompanying experiences and emotions like enjoyment and happiness that can potentially make our lives more enriched and meaningful. So some different leisure activities, by no means a complete list, but some that may resonate with you, some that resonate with me. So things like gardening, painting, collecting, fishing, biking, traveling, team sports, and yes, even in some cases, as in the case of my wife, not me, exercise is an important leisure activity. So what are some of the benefits of leisure? Well, they're quite clear, actually. We've done quite a bit of work around leisure and the impact that it can have. So we see higher levels of self-efficacy and intrinsic motivation. We see improved perceived quality of life and life satisfaction. We see improved coping with and adjusting to negative life events, providing temporary relief and escape from negative life events, improved self-exploration, self-identification, and self-actualization, and the ability to experience flow, optimal arousal, and perceived freedom. So we're able to have an experience where the challenge helps to match the level of skill and enjoyment we have, and therefore producing this optimum feeling of being aroused and engaged, and having the perception of being free in the choices that we make. We define ourselves as a free society, of course, but many of the decisions we make are within a limited amount of choices. We may not have a lot of freedom in our day-to-day family lives. We may not have a lot of freedom in our day-to-day work lives, but we do have a wide range of freedom, or at least the perception of freedom, when we're talking about our leisure engagement. So specifically, when we look at some of the research on leisure and mental health problems, we can see that it leads to decreased symptoms of anxiety and depression. It can reduce both positive and negative symptoms for people with schizophrenia. It can improve the quality of life for people with various forms of psychosis. And it's helped people with schizophrenia spectrum disorders to develop coping and planning skills. And I use the literature on schizophrenia because it is considered to be one of the more serious lifelong mental health problems. And we know that leisure engagement and leisure education can have a positive effect on the course and outcome of those serious mental health problems. So we can talk a lot about the literature, but what I wanted to share with you were some personal excerpts from people that we've worked with over the last few years and how they viewed leisure education and leisure engagement and how it's affected their overall course of their mental health problem. So a number of years ago, I designed and ran a leisure education and active participation intervention for persons with schizophrenia. These were some of the more serious cases of schizophrenia, although people were living in the community. And while they were receiving somatic and psychotherapeutic treatments, they were not doing anything else. None of them were working, none of them were married, none of them had children who they were living in the house with. So they had reported that they had spent a significant amount of time alone. And they spent, the only time they went out, they spent going to and from the doctor or from seeing their case manager. So we engaged them in a series of educational blocks, 2-3 hour educational blocks individually. And then we designed outings with them where they wanted to go out into the community. And then we engaged in those outings with them. And then we looked at the feedback from those outings. So I'll read some of these here for you. Paul had shared that leisure is something that makes you forget about your problems and your sadness. It gives you a chance to enjoy what you love doing. It makes me forget about my illness and my sad thoughts. It makes me concentrate on the activity that I am doing. So that's what I like about it. Similarly, Winston had said, I enjoy leisure in general. That's the reason I do it. If I don't enjoy it, I stop doing it. I like to take walks personally to clear my head because I'm taking a lot of antipsychotic injections. I take happy pills and sleeping pills, and it stresses my immune system quite a bit. It's stressing my stomach also. It's always good for me to get out, get some fresh air, and clear out my head. So seeing the advantage here of engaging in leisure for both of these individuals with a serious diagnosis. We also went back and spoke to the case managers, so the people who work directly and work most with the persons with schizophrenia. And we wanted to better understand what they viewed leisure as and what their views of leisure were and how they could see leisure as a form of intervention daily in the clinic. And for example, Lois has said, I think it, being leisure, is very important for their, being the patient's, self-esteem, their feeling of self-worth. I think when you do leisure activities, especially if they are in a social context, you have fun with people. I think play is wonderful. I associate leisure with play. Children are natural at it, and when you become an adult, it becomes secondary for some people. It helps people with their sense of self-worth, their self-esteem, and their self-confidence. So Lois certainly saw the value of using leisure as a form of intervention for helping people with these serious mental health problems. Similarly, Peter had said, for my clients, when they see their friends or they engage in activities that make them feel good, it really helps them to feel better. It helps them to escape their daily troubles, feel less alone, and reduce the impact of symptoms. I think leisure for them is a place where they can escape the difficulties they experience day to day and to help them to feel better. So very much what we see resonate in the literature resonates with these individual perspectives from both the persons with the mental health problem and the case managers who work with them. So we can see the value and importance of leisure for all people and the positive impacts it can have on one's mental health. Now, recently, I've had the pleasure of working with Perform in the Webster program and working with the seniors who come in to Perform. And these seniors never disclosed to us that they had any diagnosed mental health problem. Some of them had said they were dealing with social isolation, but they come in to Perform through the Webster project, and they engage in exercise on the conditioning floor and an evaluation. They engaged in nutrition and cooking. And they also have the opportunity to engage in a 6-week leisure education program with us. So they come in, they get the exercise, they get the nutrition, and then they get a bit of leisure education and the ability to develop some leisure-related skills. So we've done several 6-week interventions with them. Most of the feedback about the program has been they wish it was a bit longer so that we can continue to engage in more leisure. But all of the feedback has been predominantly positive about those experiences. So for example, Megan had said, so yeah, I learned that there's a lot to do still for seniors. We shouldn't stop. We can always learn something. That's what I really feel. I love the leisure program. Mary had said, what I'm learning now is I can still be out there. I can still learn. I need to be out there, and I need to continue learning. I need to. I cannot sit back and wait. I have to get out there. I have strong needs. So being part of that class, that group, lovely people there. So what really resonated with me here from the data was that although we had taught and they had learned individual skills like painting and sculpting, for example, they didn't focus on learning those skills. What they focused on was that engaging in leisure and learning about leisure opened up this idea for them that, you know, even though their work lives had stopped and some of their family roles had stopped, they could still move forward, continue, and learn and engage with life on a day-to-day basis through leisure. So that really resonated with them. And when we looked at this data, it really resonated with us. So how do we learn about leisure education? Many of you might be sitting there thinking, well, leisure is kind of easy. I just go out and I engage in it. But that's not what the data suggests. Leisure can be a complicated endeavor. So we can learn about leisure through what we call leisure education. And this is a developmental process where you as an individual develop a better understanding of leisure, of yourself in relation to the leisure that you do, and that greater relationship between leisure, lifestyle, and your community. So you can use leisure as an opportunity to improve oneself, to improve one's social connections, and also to improve one's community through more active forms of community-based leisure and volunteering, for example. So one of the ways we can do this is through learning through an education content model. So if today you're on the line and you are a therapist and you're working with various clients, this can be an educational model or tool that you can use to better inform your clients about leisure. If you are an educator, it's certainly a content model that you can use in education. We've recently submitted a paper and it was accepted on leisure education in elementary schools, and there's been a call to teach leisure education in our school curriculums for a number of years. It hasn't necessarily happened in all schools, particularly in public schools, but it's certainly something that we look forward to moving forward with, and to having opportunities for children to learn about leisure in schools at a very young age, the way that they learn about other subjects. Because as I said, it's not that easy. And if you're an individual, you can certainly use this model to help educate you about the various facets of leisure and how you can improve the different skill sets. So I won't go through all of these for the sake of time today, but what I will say is that if you become more aware of leisure and have a knowledge and understanding of what it is, if you become self-aware of what it is that you value as leisure, what your attitudes towards play and leisure are, that can lead you to dig around and uncover different resources and opportunities in those communities. Those opportunities may lead you to engage more in different social aspects of your community to help build those skills. And of course, engaging in those activities can help to build both traditional and non-traditional leisure-related skills. So how do I leisure? What do I do? And this is going to be one of my final thoughts for the day and something that I hope resonates with you as you leave the presentation today. And that's, I suggest that you take the time to educate yourself about your leisure preferences. Take time to discover what it is that you enjoy, that you see value in, that you enjoy spending your time in. And of course, that might change over time. The leisure that we prefer in our teens may not be the same leisure that we enjoy in our midlife or in our retirement. So take the time to educate yourself about what it is that you prefer. Actually schedule time out of your day to engage in leisure. Not all leisure happens frivolously. We schedule time in our day to exercise, we schedule time in our days to eat, we schedule time in our days to work, but we often neglect scheduling time in our day to engage in the things that we love. Plan your activities. When you are able to plan and engage in planning, it certainly helps to spark new ideas, to help you look for different possibilities and opportunities. I even suggest journaling, videoing, or blogging about your leisure. Share those experiences with others. Those shared experiences can help to create a shared leisure community. Engage in individual and family leisure if you do have a family. So take time for yourself, and if you have a family, look for experiences where you can engage with those other family members. Even when my dad was late in his dementia and having a significant amount of trouble comprehending anything, we still could sit down and enjoy a hockey game together or a ball game together, because that was something that we had done for quite some time, and we enjoyed engaging in that even during the end of his life. And my biggest suggestion to you today is try new things, even if you fail. The important thing is to try. Many of us will try things, we'll see that we don't like them, and we'll move on to other things, other leisure engagements or activities, but the important thing is that we try. So I've also posted a couple of sets of resources. I know that the presentation will get posted online. So these are some mental health resources that I think are important for all community members to have access to. ementalhealth.ca is a wonderful resource for Montreal and the resources in and around Montreal. Crisis resources, as well as long-term mental health resources. AMI Quebec is also a great partner in and around Quebec that can help with mental health resources. And if you are a student at Concordia on the call today, or you're working at Concordia and you need to help students to have a better understanding of their mental health or help guide them to mental health services, we have those Concordia links as well. Now, I also know that the last few months have been particularly challenging on our leisure because a number of different venues have been closed, travel has been limited, and a lot of different things have changed and will continue to change. And some of the early literature suggests that, some of the early research out of the last 3 months suggests that people are itching to get back to those environments that they're so comfortable in, but there will be a delay in those. And that a lot of our leisure patterns have been affected and have changed, and the long-term course of our leisure engagement will change related to COVID. But one of the things that I love to do and our family loves to do is travel. We love to do museums, and we have 2 small children, so we do theme parks. And of course, all of that has been limited. So we've spent a lot of time over the last few months educating ourselves about the various opportunities that occur online. And I've just compiled here 5 different types of opportunities, which I feel are really good virtual opportunities. So a tour of the Smithsonian, a tour of the Louvre, a tour of NASA. My 6-year-old son is really into space right now. The San Diego Zoo isn't the only zoo that provides live cams, but it's for us the best one. And you can even take a virtual tour of Disney at the moment. So all of these are some potential opportunities if you're into art, if you're into sculpting, if you're into space, if you're into animals, or if you're into theme parks. Those are some of the virtual things that you can do right now, even though we're limited in our leisure movements. So that's what I have for you today. I know that now we're turning it over to questions and comments. So I think I've done okay on the time, a little bit over. That's usually my MO.
Thank you, Shawn. That was great. So I just want to remind all the attendees, if you do have any questions for Shawn, to use the Q&A button at the bottom of your screen. At the moment, Shawn, we have just one question.
Okay.
So the question is, what about the problems of pathologizing every mental episode into the mental health problem? Do we all have inherent mental health problems?
That's a great question, and something that I struggle with myself. I mean, we as a society, as individuals, we love to categorize every little symptom that we have, and we categorize those symptoms so that we can fit it in a neat box and treat it. I think that as we've evolved and learned more about positive mental health, we've gone away from suggesting that every little incident in an individual's day is a mental health problem. But certainly when we look at a number of repeated patterns over time which affect functioning, those are classified as a mental health problem. It isn't to suggest that diagnoses are always 100% correct, or even courses of treatment. I mean, if we look back of what we were doing in the 1930s compared to what we're doing today, we find some of the treatments in the 1930s to be atrocious. I'm certain, almost certain as I can be, that moving forward in 30 to 40 years from now, we'll probably look back on some of the institutionalization and courses of treatment that we engage in today and look at it and wonder, why did we engage in it, or why did we categorize it in that particular way? So that's a great question.
Thank you. We had one more question that came in. Can you talk about how we can help people reduce leisure barriers, especially if they have mental health challenges?
Certainly. So reducing leisure barriers is a major thing for all of us. I don't think necessarily for only people with major mental health problems. We see leisure barriers in underprivileged communities. We see leisure barriers for people of color. We see leisure barriers for women. We see leisure barriers for the elderly. So one of the things we can do is take a community-based leisure education approach so that we can inform politicians and the people in our communities who set up and engage in leisure or set up leisure opportunities for people to better understand the needs and desires and working with people with serious mental health problems. So I think there are some policy changes that we can work on. We can educate the different leisure places like the YMCAs, the private gymnasiums, the various leisure opportunities in the community. We can educate those individuals about working with people with mental health problems, show that one of the big things is people have this belief that people with mental health problems are dangerous. And the data suggests quite the contrary. Most people with a serious mental health problem they have something criminal done to them. They're not criminal offensive. So I think that education is one important piece that we can help to teach people. I also think that for those people who are receiving treatment in an institution, or for people who are receiving treatment in an outpatient clinic, for young therapeutic recreation professionals, for young leisure professionals, we can go in and make changes in those environments, like I had tried to do during my graduate work, to spread the word about the importance of leisure education, the importance of leisure education and leisure engagement, and to help to build programs within those clinics to help reduce those barriers.
Great. So we have a few more questions that have come in.
Sure.
So one question here is, can people that do not like physical activity be considered mentally sick? Physical activity is so important to your well-being. How is it possible that some people don't like it and be healthy? I'm beyond trying to motivate people and try to understand why they do not like it.
Yeah, I don't think that if someone doesn't enjoy physical activity that they have a mental health problem. I don't enjoy physical activity. I know a number of people who don't. Physical activity, like anything else, is a preference. Too much screen time is not healthy. And if eating poorly is unhealthy. Smoking is unhealthy. Drinking is unhealthy. All of these things are unhealthy. They can certainly lead to diagnosed addiction and related problems, but I don't think that I wouldn't categorize somebody who doesn't enjoy physical activity as having a mental health problem. I wouldn't anyways. I do see the value, of course, of physical activity as being important to health and well-being, but I wouldn't categorize someone as a mental health problem who doesn't enjoy engaging in physical activity.
Wonderful. Another question, if schizophrenia is in your family or partner's genetics, is there a way to prevent it developing in a child?
That's a great question. There are percentage chances. It certainly doesn't mean that everyone who has a parent with schizophrenia will develop schizophrenia. Of course, if we have this sense that something is wrong with any one of our family members, it's of course important to seek treatment early on and to get that problem identified early on. But it isn't as simple as simply saying, because one of my parents has it, I will have it. There's still a percentage chance that you will never have it. And for schizophrenia in particular, where we see the development is usually in the late adolescence. It's what we call first episode psychosis, is where we see changes. And the first episode, or FEP literature, suggests that if we have identified a problem and we get on it early, it's going to significantly impact the course and outcome of that diagnosis.
Perfect. Another question here. I am a kinesiologist working with people having chronic pain. Exercise is important for them, but I always want the sessions to be fun. Is that an important part of treatment effects?
Yeah, I do think fun is an important part of treatment effect. I think that people need to, if we look at what we're going to engage in long term for those individuals, I think that there has to be an element of enjoyment and fun within that. For me, that's an important component. It helps to keep people hooked to what they want to do. Safety is, as a kinesiologist, I'm certain that safety is your primary concern. And after safety, it's, improvement and whatever you're targeting, reduction of pain or improvement in mobility or flexibility. But I think if you want people to engage in something long-term, right, we talk about starting off with a significant amount of treatment and reducing that level of treatment and improving level of independence. So as we improve that level of independence, I think it's important that people find things that they enjoy doing. So for example, you may need somebody to get a certain amount of cardio a day and they just absolutely hate running, but they enjoy biking. So finding them opportunities to bike, helping them to find a bike, finding the proper routes for them to bike, you're going to have probably more adherence to that than forcing them to do something that they don't enjoy engaging in.
Thank you. Next question. What is the difference between a lack of skill and a mental health problem? Many mental health problems that you have illustrated seem to be a lack of skills. Example, social skills.
I think that skills are affected, but not totally skill sets. There are changes in mood and behavior as well. So those changes in mood and behaviors have a great impact on the individual. And yes, there are certain skill sets that are affected by mental health problems, including social skills. But skills are not the only things that are impacted. I think skills are one part of a much larger interaction of issues going on within the individual.
Perfect. Next question. Technology has created many populations with a sedentary lifestyle. How do we move kids and adults away from that behavior, and what is the impact of such a lifestyle?
Yeah, so we've looked, we're talking a lot about the increase in screen time and the effect that it's having on children's mental health. I haven't read the article, but I had pulled it the other day about some of the initial studies now that have been done looking at child mental health during the COVID crisis and the increased use of screen time. Technology and screens are certainly an important component for a lot of what we do, especially right now. We're being asked to teach in this medium. Entertainment comes in within this medium. Children communicate within this medium. A lot of the things that we're told to practice, right? We talk about limits on screen time. We talk about having automatic shutdowns for children after a certain number of hours. I think that helps limit. As your children age, I think an open and honest discussion with your children about the importance of branching out beyond the virtual world, educating children early on and engaging with them in the various leisure opportunities that can help them to develop a leisure repertoire or physical activity repertoire that goes beyond the virtual world. Those are some of the things that we can certainly do. And human contact. Human contact and interaction is something that we want people to engage in. That as they're young, they can understand that in addition to tweeting with each other or being in virtual rooms together, that one-to-one human contact is an important component of our health.
Okay, thank you. We have just a few more questions here. Next question. My grandparents have mental health problems, which they refuse to accept because they believe those with mental health problems are psycho, and therefore they refuse to seek treatment. How would you go about trying to change their beliefs around mental health?
Well, what we've seen is a lot of older adults enjoy expertise literature. So they like going to the expert. So what you can potentially do is talk to them about or with some expert literature. So show them some of the things in the expertise literature that they're going through that might resonate with them. Talk to them from the professional's perspective, not the grandchild's perspective. So say, I know grandma or grandpa, you're experiencing these symptoms or you're experiencing this day to day. Look what this doctor says. Look what this professional psychiatrist says. So showing them some of that is important. Talking to them about how some of it has changed over time and helping them to root them in some new knowledge and understanding about the stigma might help. But that's a challenging question. I mean, I myself, even with all of the experiences that I've gained over the years, I myself had a very hard time convincing my parents that there was a problem, a change to their health and well-being, even with all the knowledge I had. There's also the issue of anosognosia. So many individuals who have a diagnosed mental health problem, psychosis, dementia, they have trouble understanding or introspectively looking at the fact that they have a problem. So that it impacts their ability to understand that there's something going on as well. That could be directly related to the mental health problem. But my suggestion would be open and receptive, use the expertise literature, show them some of the changing knowledge, and be as supportive as you can in trying to help them as they move through that particular health problem. For many of them, they might be raised in an era where this was, the knowledge that was discussed at that time was around this. You're either lazy, crazy, or stupid, or psycho, and that's not me, and I refuse to accept that. So it's a hard one for sure.
Yeah. Just a couple more questions. Next one is, which leisure activity is mostly enjoyed by the elderly based on your experience? Which one can improve cognitive functions in elderly with dementia?
So that's a great question. What we found in this, this is my first opportunity to work with older adults. I work predominantly with kids and adolescents. What we found was that the older adults really enjoyed the social components of the leisure activities. So being able to share and exchange ideas, being able to talk about past experiences, and being able to make a link to people in the group. So that was a big opportunity for them. With regards to cognitive functioning, I'd have to take a look at the literature to be able to give you a definitive answer on that. That isn't something that I'm not an expert in that area. But we do see discussions around things like memory games, Sudoku, the use of numbers, and the positive impact that those can have on cognitive functioning. We also, from the therapeutic recreation literature, look at reminiscing therapy and the opportunity for people to take a look back at their history. We know with dementias that some of the last things to go are the very oldest memories that we have. So some of those types of therapies can help with day-to-day functioning as well.
Thank you, Shawn. We still have a few questions that keep coming in. I see we are at 1 o'clock right now. So I'm just going to take one more question, and then maybe we could try and do our best to answer some of the other questions offline. But for those attendees, if we haven't answered your questions, again, feel free to email either the Perform Center or Shawn at any time. So our last question here is, what recommendations would you have to those with caregiver burnout?
Yeah, so as like myself, my recommendation is first and foremost recognizing that something has changed. I don't feel the same way that I have felt. I'm not operating in the same way that I've operated before. Recognizing it is the first important step. The second step is to put a plan into place to either supplement some of the care that you're providing with professional care, or if you have other family members to provide that care, to help them to provide that care. In my case, I didn't. I'm an only child to my mom and one of 4 to my parents, but my father and my sister predeceased me, and my 2 brothers are older and living away. So for me, it was predominantly on my shoulders. So look for supplemental forms of care, particularly professional care if you can. And when you have that time away from care, do the things that you know can positively impact your mental health and well-being. So taking the time to get the appropriate amount of sleep, taking the time for yourself to engage in some of the leisure that you enjoy, going away from caring for others and caring a bit more for yourself and your own health and well-being.
Great. Thank you very much, Shawn. So that's all the time we have for questions right now. As a reminder, this talk has been recorded and will be posted on our website for later viewing. So I just want to take this time to say thank you, Shawn. I'm sure I speak on behalf of everyone. It was a wonderful presentation. And to all of our attendees, thank you very much for attending, and stay safe.